125 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
Thank you. I'm really honored to be here, and I'm really happy that the conference is the first week in April, because I'm always busy the second week of April, which is when this conference has usually been held, doing medical evaluations of asbestos-exposed individuals that have been coming to us following in the Selikoff legacy for their asbestos surveillance exams. I'm going to talk to you about asbestos and ovarian cancer, and this is something that we don't often hear about. Linda mentioned that there are about 780 ovarian cancers that are due to asbestos that are diagnosed per year. And I think it's something that if you ask a gynecologic oncologist, if they realize that asbestos causes ovarian cancer, you will get a blank stare and they will have no idea. So when I spoke to one of my colleagues and I was asking, did you know that asbestos causes ovarian cancer? And he said, no. And then he asked me if I'd give grand rounds to his department, which I did. And grand rounds is a medical lecture series that's given departmentally. And there actually was a bit of resistance from people saying, because they never heard of it, this couldn't necessarily be the cause. But I thought I'd take you through some of the information. I just want to disclose I do serve as an expert witness in asbestos litigation, but that doesn't change the fact and the facts. So asbestos can get into the abdomen, and the question always has been, where's the malignancy? Is it in the peritoneum, or is it the ovary? We know about pleural mesothelioma as well, and it can cause mesothelioma around the pericardium. And as data will probably show in future years, more conclusively in other areas, as was discussed in the first panel. So one of the questions is, how does the asbestos cause the ovarian cancer? Is it that the asbestos causes inflammation in the ovarian tissues? And they found the asbestos in the fibers of occupationally exposed women. It's also found in non-occupationally exposed women, and the question is, how did it get there? So one way it could get there is through talc. How many of you have ever been asked if you use talcum powder when you go to the doctor? And I saw a resounding no hands. And so no one asked, so no one knows. So let's get back to how might asbestos get to the ovary. It's not clearly understood. There's been some thoughts. There have been studies when women undergoing surgery, they put in some fibers, they put in some inert carbon in women who are undergoing hysterectomies and oophorectomies, just to see, because they were removing the organs. They wanted to see, do things move upward through the vaginal canal, and can they get into the fallopian tube and therefore get into the peritoneum and the ovaries? And they found that they could find these carbon particles. It can get through the blood, it can get through the lymph, and get into the mesothelium. That should be mesothelium. And there also can be exposure through talc use that might be contaminated. So there have been animal experiments. If you look at certain animals, you're not going to find anything because their anatomy is different. So then they'll say the animal model doesn't prove it. Well, you picked the wrong animal. Unfortunately, they have sacrificed a number of animals to do this, but they found that mice and hamsters aren't a good animal model because of their anatomy. But if you looked at rabbits and guinea pigs, their anatomy was more similar. And so you could find some of the changes to the ovarian surface that were similar to what you might see in human ovarian tissue. They didn't see any of these changes when they looked at animals not exposed to asbestos. There have been studies that looked to see if asbestos could be measured in the ovaries of women. So they found, they looked at a number of women who were undergoing removal of their ovaries for benign conditions. So this was not a cancer study. And this was just to look to see in individuals that had known exposure versus those who didn't, could you find? So what they found is that about 70% they could find of people with known exposure, they could find asbestos in the ovaries. And that in the controls, they found it in 6 of the 17 that were studied, but the levels were lower. What they did find was talc in 11 of 13 exposed women, but not really in the controls. And the conclusion was that exposures might be related to exposures from the husband that were more significant from the father, which was through laundering the clothes, rather than through sexual relations. And then could there be the introduction of asbestos fibers into the vagina during sexual contact? There was a study that came out that by Camargo, and this is a meta-analysis where they take a number of studies and they look and combine all the research that's been done to see. And if you, the big thing is there's a line there, and if you look everything to the right of the line shows an increased association with asbestos exposure and ovarian cancer. What they did find is in the groups that had high rates of lung cancer, they also had the highest rates of ovarian cancer. And it supported the IR conclusion in 2012 that exposure to asbestos, or in 2009, exposure to asbestos was associated with an increased risk of ovarian cancer. These are some studies that give us the background. And one of the issues is women didn't work traditionally in jobs occupationally where there was a lot of asbestos exposure in the numbers that men did. So we go back and we look at studies that were usually looking at pleural disease or asbestosis or lung disease. They found in England that there were women during the war years in an asbestos factory, or in a textile factory, that in women who were severely exposed to dust, you saw 4 deaths when only 26 were expected, and that means that it's a statistically significant finding. 3 of the 4 had severe and long exposure, so again, we're seeing a dose response. In Italy, and these were women who were exposed to different kinds of asbestos, again in a textile factory, there were a number of mesothelioma deaths, but there were also ovarian cancer deaths. Cement workers from Casal Montferrat, which is a notorious area which contaminated not only the plant but the environment. The female workers had an elevated risk of death from ovarian cancer, and particularly those who had worked there for longer periods of time. Now, if you look at the rates of ovarian cancer, they were about double the rates of disease that were seen in the women with take-home exposure, but they still had increased rates of ovarian cancer. So these were, the workers had higher exposure, and they also had higher rates of ovarian cancer. Other studies in Italy have looked at women compensated for asbestosis, so those who had higher rates of asbestos exposure, we see increased, these are standardized mortality ratios. This means that it's much more likely that there was, deaths were due to the asbestos exposure. We see that in textile workers and cement. There are plumbers in Finland and in Denmark that had increased risk, so here's an occupational group. Gas mask assemblers who also had increased risk. The printing industry, the industrial talc is used in bookbinding. They found mesotheliomas both in Russia and in Finland, and they also found ovarian cancers in these groups. And again, it was in the bookbinders more than the others in the printing industry because they had that. And I am about to talk about the culprit that we've been talking about a little bit, and I have 1 minute left, so I'm going to do this very fast. What I do want you to note is, you see that in the upper right corner it says with the warning label. The warning label is so that you don't expose your child to breathing in the powder. So it has nothing to do with the cancer risk. But the warning labels come, don't let your kid breathe this in, which is a good idea. Because if your kid breathes it in, they can cause lung problems, but also we know later on it might be a culprit in causing asbestos-related diseases. This is just what happens when someone uses powders. We see asbestos associated with the talc. We see talc and ovarian cancer has been shown by Crawley to show that there are increased risks. And again, you see that line going down the center, and you see the majority of the studies have an increased risk. And these are just some questions that people should be asked. As clinicians, for those of us in the room who are seeing patients, how long did someone use talc? When did you start using it? Who used it on you? Were you around others who were using it? Was it before you had tubal ligation or hysterectomy? Because we know the rates of exposure might be different. So again, just to summarize really quickly, there's sufficient evidence from IARPA 2012 about lung cancer, mesothelioma, laryngeal cancer, and ovarian cancer. And I just want to make sure that ovarian cancer is on the radar as being caused by asbestos. I think there may be some issues related to gender and thinking about the exposures, but as someone once said to me about some other diseases, if you don't think about it, you'll never find it. So if you don't ask about it, you'll never know. So I hope I've given you a little roadmap on the fact that ovarian cancer can be caused by asbestos, and thank you for your time.